नमस्कार. प्रुडंट मिडियाच्या हॅलो दोतोर कार्यावळीन तुमकां सगळ्यांक मना काळजासान येवकार. तुमकां काळजासान आनी मनासान येवकार दितना आयज आमचे जे गेस्ट आसा तेमचे एक्सपर्ट जे आसा ती आसा डॉक्टर जिन्सी जॉन, पेडिएट्रिशियन अँड निओनॅटॉलॉजिस्ट म्हणजे ल्हान भुरग्यांचे तज्ञ दोतोर. आनी आयचो विशय आसा तो म्हणजे मातसो असो एक सिरियस विशय, तो म्हणजे डेंजर सायन्स इन चिल्ड्रन. म्हणजे ल्हान भुरग्यांचे खंयच्या वेळार डॉक्टरा कडेन वचप खूब गरजेचें आसता किंवा पॅरंट्सांनी म्हणजे पालकांक हें कळपाक जाय की बाबा आतां थिंग्स आर गोईंग आउट ऑफ कंट्रोल. तेन्ना घरा कडेन बेश्टे हे उपाय ते उपाय करत रावनासतना तज्ञ दोतोरा कडेन वचप गरजेचें. आनी म्हाका दिसता हो विशय आयच्या जे आमी हे पावसाच्या दिसांनी किंवा हरशी सुद्दां ह्याची जाणवायकी आसप, जाणीव आसप सगळ्यां खातीर म्हत्वाचें आसा. सो डॉक्टर फर्स्ट ऑफ ऑल आय वेलकम यू. नमस्कार. आमचे बरोबर आसा डॉक्टर जिन्सी जॉन. खरें म्हणजे तांचो जो अभ्यास आसा तांचो चडसो प्रवास गोंया भायरच जाला, गोंया भायरच ते शिकल्यात. So basically, but still you opted because your parents were in Goa, and still you opted to come back to Goa. So before you opting to come to Goa, I would like to know what are the milestones of your journey, in academic journey.
Yes. So thank you for the kind introduction, Dr. Rao. I have had quite an interesting journey. After my graduation has been all outside Goa. I have done my MBBS in D.Y. Patil, Kolhapur. After that, I have worked in multiple mission hospitals. I have done my diploma in child health from Christian Medical College, Ludhiana. Continued working in areas of need and mission hospitals. Further, then decided that I want to pursue and rather excel in pediatrics. So then I further went ahead to Christian Medical College, Vellore, where I did my master's in pediatrics. So after that, I continued working for a couple of years, and I decided that now I just want to come back home, come back to Goa.
Very good.
And have an experience here how it is to be back to my home place.
Basically, पेडिएट्रिशियन म्हणजे लहान भुरग्याच्या दोतोराक खूब कडेन भरपूर स्कोप आसा, डिमांड आसता. तरी पण in despite of that you opted to come to Goa, and I'm happy that you are associated with one of the premier institute of Goa Medical College. So it is a pleasure. Doctor, first of all, when we talk about danger signs, what you mean by danger signs? Because whenever people want to know, like, what you mean, which are the danger signs, or what you mean by danger signs? Please clarify on this topic. First of all.
So now, as we know, it's the monsoon season. Children are falling ill left, right, and center.
Correct.
So one of the most common things which parents will find that the children frequently faces will be cough and cold.
Yes.
So even in cough and cold, it can just be something very minor, like just a viral infection which is causing this.
Absolutely.
If it is bacterial, it can of course turn out to be serious. But one of the most common causes will be pneumonia. So having said that, just having a cough and cold can also worsen to a very serious degree, and it can have its complications.
Absolutely.
So difficulty in breathing is what we would normally say is the danger sign that we look out for. The cause can be pneumonia, it can be infection in any part of the body, or because this is how children will present themselves.
Absolutely.
Or it can be because of probably some allergic reactions. There can be multiple causes. If it's a very small baby, it could be because of an underlying heart problem.
I see.
So this is what your difficulty in breathing would be. Second, we could say would be unconsciousness, lethargy. So how do we see that this child is sleeping too much? They must have just started with cough and cold, having difficulty in breathing, fast breathing. They are having something we called as chest indrawing. They have all these symptoms, but it gradually worsens, and the child starts sleeping too much, sleeping most of the day. Further on, not responding when we are calling out to them. So this can be because of, again, respiratory infections. It can be because of some underlying any infection in the body, because of diarrhea causing severe dehydration. So also, if they have some we can say brain fever, which they must have caught on some way, or if they have probably had a fall. So there will be a lot of associated symptoms also along with this, and there will be signs. So this is so just basic. If you find the child sleeping too much, that is also a cause of worry, not arousable. In the sense, you call them, you will know the behavior of the child.
Absolutely.
So not waking up, or being very irritable, wanting to sleep, not responding properly. These are that's one of the second important cause. The third we could say will be having diarrhea. loose stools. Now this is the climate where they can develop profuse loose stools, and parents will think that it is fine, but we have to concentrate on the frequency. How bad is it? Is it like profuse watery, just water, babies just passing water? And if it is associated with blood or mucus, so it can be because of dysentery. So all these causes become very important. Why? Because this can lead to dehydration.
Absolutely.
Now that is something very serious in children, because they rapidly lose the body volume, the body fluids in their body, because of their high surface area. So this is another thing that parents have to be aware. Caregivers have to be totally on their alert, like how is a child responding, behavior, very important. The third we could say will be fever. Now a child having, the interesting thing is in small children, high fever or being cold, that means hypothermia or hyperthermia, both are significant. So in a child, we will say when a temperature is more than 100 degrees Fahrenheit or 37.7 degrees, that is significant. So then what we need to do is, you need to first do your cooling measures, which I'll come to. But also having a temperature which is less than, say, 36.6 is also very significant, especially in the small infants, in the neonatal period also. Why? Because hypothermia is also a cause for infection. So that is how they will just be cold. Their body will be cold. Hands and feet will be cold in small babies. That is very significant. High temperature in children more than 1 year, 2 years, and if the temperature is going very high, so also in the infancy, this can be associated with seizures, which happens quite a few times, especially if they have a genetic predisposition, or if this can just be a sporadic cause. So they will come with abnormal movements or seizures, sometimes which might stop in probably 5 to 10 minutes. Sometimes it can be prolonged, and it can keep occurring again and again in this age group between 6 months to 6 years. So this is also significant. So this is also something that they have to look out for when you have high fever. The other thing will be, like I said, convulsions. So the convulsions, the fits that they have can be because of febrile, just a febrile seizure, which has happened because of some underlying infection which is there, or if there is a meningitis or a brain fever, like how I have said, then the child will continue to have seizures. So this is something very important. Also, we have to look out for seizures which are associated with fever and which is not associated with fever. So like we have your provoked and unprovoked fevers, seizures. So that is like very important. So if parents are aware of what they have to look out for, that is very important.
Correct.
Also another important thing is that in small children, seizures don't always present like how they do in adults. So what happens is, in adults, we have a typical stiffening and jerky movements, how we will say in very simple terms. So in small children, they can present as that also, or they can, in small babies, they can just have blank staring movements. They'll just be staring, and you know that they are not in that space. They are not present at that moment. They'll just be staring at you for a couple of minutes or seconds. Or they might be just having some cyclical movements of their legs or hands, or just some abnormal movements, some orofacial movements, like they might be just having some lip smacking movements or some chewing kind of a movement they might have, or they might just be having some irritability, not sleeping at night, irritability, a very shrill cry, which parents will understand this is something different. A normally well child who is very irritable, not being able to be consoled, crying incessantly, that is something very significant. So that is something that we need to look out for. Also, jaundice, now that the climate is the monsoon season, there will be a lot of waterborne infections that you can have, so like your hepatitis, etc. So that is significant. Again, when they become too yellow, you'll have an idea. They'll have all your vomiting complaints, they'll have complaints of not losing appetite. And an important thing of jaundice in small babies will be, which can be which is not an infection in small babies. In them, after around 1 week to 2 weeks, if a jaundice persists in a small baby, now that will be significant, because that becomes more of a pathological jaundice is what we say. And then we have to see whether it is increasing If you see it on the palms and soles, if they're looking very yellow, we have to see the color of their urine. How is the color of their stools? If it is white significant, that can be something like an obstructive or a cholestatic jaundice. If it is a typical kind like biliary atresia, they need to be operated immediately. So those are the things that you look out for. Second thing is when we have persistent vomiting, not able to drink, and they are not able to keep down anything that they're having, whether it is food, liquid, anything. So that now in the different age groups. Now if it is a small baby, after every feeds, they might have a little bit of regurgitation. We won't call that vomiting. That by spacing of the feeds and by burping appropriately, it improves. But in an older child who is not able to keep down anything that they are having, now that becomes significant. So in that reason, we have to see like, are they getting dehydrated again? The same way we speak about loose stools. If it is associated with fever, continuously, persistently, then we need to take medical advice. If the child is not having any fever, but there is vomiting, greenish color vomiting we say, or there is some abdominal distension, like we say port fugle kind of a thing. So in that case, then they have to come and show, because this can be some intestinal obstruction.
Absolutely.
So this now becomes significant. So in children, we need to know the color, the amount, what are the contents of either it is a stool or of a vomitus. That is very important for us.
So basically, in short, दोतोरान सांगला की आमकां म्हणजे बरेचशे जाणी तांणी आमकां सायन्स सांगला की एक म्हणजे जोर आसा जाल्यार जोर तो कितक्या लेवलचो आसा सांगला की 100 डिग्रीच्या वयर आसा जाल्यार इट इज अलार्मिंग सायन. कमी आसा म्हणजे सामकें आंग थंड जाला जाल्यार एक अलार्मिंग सायन. समजा ताका कामीण आसा जाल्यार अलार्मिंग सायन. तुमी एक लक्ष दवरपा जाय बाबा कितकी आसा, कितक्या लेवलची आसा. तिसरें अशें आसा की केन्ना केन्ना संडास जाता पण तो खूब पातळ आसा, कितले फावटी जाता, फ्रिक्वन्सी, किंवा उलटी येता जाल्यार तेका वकारी परत परत आनी तेजी फ्रिक्वन्सी कितली आसा, म्हणजे ते भुरगें डिहायड्रेट म्हणजे सुकें पडपाक लागलां काय कितें, हाचेर लक्ष दवरप. जोराचें जे सांगलां तेच प्रमाणे बाकीच्यो ज्यो गजाली आसा त्यो सगळ्यांचेर लक्ष दवरप, की थोडे थोडे मुवमेंट्स आसतात. जशें डॉक्टरान आतां सांगलां की आमी म्हणटा की भुरग्यांक मारून आयले किंवा मल्लुकेचे कशें जाले, किंवा ते दोळे परतिल्ले, किंवा अशें कंटिन्युअस स्टेरिंग करत रावले, किंवा ते हातापाय म्हणजे तोंडाचे अशे वेगळेच मुवमेंट करपाक जे युजली आसनात, किंवा त्याची एक्टिविटी सामकी कमी जाल्या आनी ते भुरगे सामके अशे आळशी कशें जाला, सामके न्हिदून रावता. अशा वेळार तुमी सारकें लक्ष दवरून त्या भुरग्याक बेगोबेग दोतोरा कडेन व्हरप खूब गरजेचें आसा. Doctor, now you have mentioned about lot of science and this thing, presentations from the child side. Now let's come to the role of the parents. Now when the parents should take into, this should be again warned, or they should be on alarming, or they should be on their forefront, because this is a time of the, like, see, as we started with the monsoon season, child likely to get fever, likely to get some vomiting, some indigestion, this and that. But certain conditions you cannot just keep on waiting.
Yes.
Now is just time you have to consult a doctor or a pediatrician, to be very frank.
Yes,
so
absolutely.
when you will consider this?
So now in such a situation, what happens is that small children, they cannot communicate. That is the major problem that we have with small children.
Yeah.
They find it very difficult to communicate. At some times, you probably a 1-year or a 2-year-old child might point out or just show restlessness. But a small baby, an infant, a neonate, they might just only cry.
Correct.
Restless, irritable, not consolable is what we say. So in such situations is when we look at these different signs, like I have said, in difficulty in breathing, signs of dehydration, excessive sleepiness, difference in their behavior, which is something very important. Because this is the whole idea about explaining about these danger signs is that there are certain instincts that parents have.
Correct.
When they understand this, they will know what can be treated at home with home remedies, for what you can just take a doctor's consultation, medical advice, for what you need to rush to the hospital and take a treatment immediately. Because what is important is that we require timely intervention.
Absolutely.
And if not treated on time, they can easily go into further complications. Like you have your in various illnesses. Now we have malaria and dengue.
Absolutely.
Which is so common in the monsoon season, and we have plenty of that happening right now.
Absolutely.
We have pockets in Goa which are totally, they are endemic to these these illnesses. So for this, now we have to make sure that the moment they have fever and they are having, say, a yellowish kind of a discoloration they are having in malaria, we say. So we know that, okay, there is a lot of the infection is going a little serious. So you should definitely take a doctor's consultation. So a fever basically, which is more than 101, 102, persisting for a day or two, and it's not resolving, and the child is really sick, sleeping most of the time, not responding, it is better to take a doctor's consultation immediately.
ओके डॉक्टर म्हणजे आमकां डॉक्टरान सांगला की आमकां जेन्ना ल्हान भुरग्याचे अशें तुमकां एक इन्स्टिंक्ट आसता म्हणजे दिसता की आतां ना आतां भुरग्याक कितें तरी मातसो प्रॉब्लेम आसा असो दिसता सो त्या वेळार तुमी डॉक्टरा कडेन वचप आनी चड वेळ घरा रावन आसा भुरग्यांचे प्रयोग करनासतना म्हणजे आतां हें दिवन पळया तें दिवन पळया ना अशें केलें लास्ट टायम केलें अशें करनासतना योग्य वेळार डॉक्टरा कडेन वचप तज्ञ दोतोराचो सल्लो घेवप आनी हॉस्पिटलान वचप गरजे प्रमाणे इज द मोस्ट प्रॉम्प्ट एडवायस मॅडम हॅज सेड. दुसरें म्हणजे मॅडम आमी खुबशे फावटी अशें पळयता की ऑफन वी सी अ चायल्ड इज बिकमिंग ब्रेथलेस वन एज यू हॅव मेन्शन मे बी बिकॉज ऑफ कोल्ड ऑर whatever. But when you will consider this breathlessness is of the severe grade and requires some urgent attention or maybe hospitalization or going to hospital as and when required.
Correct.
Because it sounds common. Breathless is
Yes.
common. It is, yeah, it is not so the same. But that but is important.
Yes. So when the child has just a normal cough and cold, they will not have something called as fast breathing. Like we say karaz marta. So why is that happening? That is because either because of it is a viral or a bacterial or for whatever other underlying cause.
Correct.
There is a stiffness in pneumonia. There is a stiffness that develops in the lungs, because of which there is a problem in the oxygenation.
I see.
So because of this, they start breathing faster. And not only that, so that we will counter as pneumonia. But now when we say that between the ribs there is something called as chest indrawing, like khadde eta between the chest ribs. So when that happens, we know that this is going into severity. So when they are fast breathing, when we see chest indrawing and something worsening in this further will be they are becoming lethargic, sleeping too much, and they start having a grunting sound is what they call. That means they have noisy breathing. Fast breathing, noisy breathing, which is there most of the time, even at rest, even not when the child is crying or feeding, even at rest. So that is something which is of significance, and we have to know that this is going into a severe kind of a respiratory distress. When we talk about the khadde dista, when we talk about in the upper part of the chest, or in any between the ribs, but this is very important. Even the type of breathing that they have. If the breathing is very fast, a seesaw kind of a breathing, very important that we have to look out for.
Okay. Doctor, now another question is that common infection or maybe because of dehydration, loose motion, vomiting, that dehydration is quite common. So how to identify, okay, this is a severe grade of dehydration which cannot be matched or managed at home, requires hospitalization or going to the pediatrician. So what are the signs and symptoms of severe dehydration or general dehydration? In short, another we have got 5 minutes. So whatever you feel significant, apart from this, you can cover up.
Okay, sure. So what happens is that children, even when we have loose stools, diarrhea, what is important is the increase in the frequency of the stools. So if it is profuse, lots in amount, the quantity that they are passing, watery, loose stools, greenish, having mucus and blood in stools, very significant. Now in this, if they are not able to drink or feed while they are having these symptoms, either because of vomiting or every time they are taking something in, they are passing loose stools. That is very significant. If the child is sick enough not to drink, so we have a categorization where they say that either they are not able to feed or they can drink eagerly. So if they are not able to take at all, we know that this is going into severe dehydration. Then signs like sunken eyes or unresponsiveness, sleeping too much, and decreased urine output, something which is very important. If they are not passing enough of urine, we know that they are definitely having a less amount of body water in their less amount of water. So that is why they are getting dehydrated. And it is very pertinent to come to the hospital immediately, because then we do not get lines. IV access becomes very difficult because they require fluid resuscitation. And once we do not get line access, it becomes absolutely different to resuscitate the child. So what the parents can do is start with things like give ORS. Make sure child is taking orally. Do not stop feeding them. If they stop feeding them, then they go on to get more and more dehydrated. So if they are persistently vomiting, immediately come to the hospital, but continue feeding them ORS. Even when we are giving them ORS, make sure that the dilutions that you give in your ORS should be correct, because that can also be a cause of dehydration again. So all these things are very important. If you have any doubt, first thing, come to the hospital, because there is no other way you will be able to manage with a child, because they'll just crash. And then you have further complications in resuscitating.
So I think, doctor, we have got another 1 minute almost. So as a message, like what you would like to advise our parents of the children, when they should go to doctor, or which are the things which should make them alert or alarm?
Yes. So one thing I would say is, if you all have any doubt regarding all these danger signs that have been explained to you, please go to your pediatrician, speak to them regarding this and get a clarity. Meet them early so that you can go in for early intervention and not wait for the complications to happen. Besides that, very important, please take care of the vaccination. Please be up to date on that. A good hygienic practice, which is absolutely important, especially in the monsoon season. Take care of the nutrition of the child. A nutrition which is a balanced diet, not just having milk, bottle feeds, that does not cover for the entire requirements in a balanced diet for a child. And make sure that the child is not anemic and having any underlying infections, because malnutrition will further worsen the situation of the child, and they progress to complications very quickly. So a child who is well nourished, which is very different from a chubby child, nourishment is very important. Okay, so if a child is well nourished, the immunity develops well, and we can make sure that they do not go in for further complications. So always go in to your pediatrician and decide how you all want to proceed about the well-being of your child.
Yeah. So, doctor, just a little academic twist.
Yes.
Because once upon a time we used to say rosy lips and chubby cheeks, but nowadays they are saying these are the people, or these are children who are likely to go into obesity later on.
Absolutely.
So, what is your take on this? Because everybody feels that आमचा बाबू काहीच खायना आहे, बाय काहीच खायना, तर काहीच खायत ना. But खायना, but weight gain is proper. In fact, they are overweight at times.
Absolutely.
So, what is your word of caution on these regards?
So that's very interesting, because most of the time parents come saying that my child is too thin, or my child is
not eating anything.
But they miss to mention that they are giving them a lot of junk food.
Correct.
It is not the home food which they are having. They will be eating either chips or chocolates, and they will readily, happily say, no, they go and have chips only, they're not eating home food. But then we have to question who is giving them the chips and the chocolates.
Absolutely.
Because the children won't be going and getting them this themselves. So this is kind of a habit which we have to develop in them, which we as adults also find difficult in following a routine. Correct. So it's not right to be like very strict with them, but if we could follow a proper diet plan where they have everything, a good nutritious food, home cooked food, which is the best, fresh home cooked food. Nothing matches to that. Then if you compare the processed foods that you get and all these products that they are advertised for, nothing matches the good old home food that we make at home. And try to taper down, decrease the amount of consumption of all these junk foods, oily, fried foods, which is a very important part of this all. So a child who might be just chubby, might be just empty calories, and might be... And they might, in fact, in malnutrition, we have something called as kwashiorkar, where you find the child to be chubby. It's called as a sugar baby. So that is, but they look nice and chubby. But that is a severely malnutrition child, because we'll find all signs in them. We normally connect only a thin child with malnutrition, but that thinness might be normal for that child, because but the child might be healthy otherwise. Probably the parents were also of a slim kind of habitus that they had. So that is absolutely fine. So if you all have doubts, if their growth is not proper, if they're not gaining weight, any doubts you all have, contact your doctors, your pediatricians. They'll be able to guide you effectively. We can see how their growth is, their weight gain, their height velocity. We see everything, and we can determine how the child is growing well, which is most important. Not a chubby child who looks very good, but internally might be having very low immunity.
Absolutely. This is very important point. हांव कोंकणीन ह्याच खातीर सांगता की सगळ्यांक सारकें कळचें म्हणून. जस्ट भुरगीं चब्बी म्हणजे गुबगुबीत आसप किंवा तेजे गाल बरे टुमटुमीत आसप म्हणजे ती भुरगीं हेल्थी आसा अशें न्हय. हो महत्वाचो मुद्दो सगळ्यांनी समजून घेवचो. खूब फावटी भुरगीं अशी बारीक आसता, सडपातळ आसता, पण ते एक्टीव आसता आनी हेल्थी आसता. तशा प्रकारची भुरगीं खूब इम्पॉर्टंट आसता आनी दॅट इज मोर इम्पॉर्टंट टू एवरीबडी. म्हणजे पेरंट्सांनी हाचेर फोकस करपाक जाय की तांकां जे तुमी खावपा दिता ते घरांत रांदिल्ले घरचे पदार्थ दिवचे. भायले पदार्थाची एकदां तांकां संवय जाली, फॉर एक्झाम्पल जशें मॅडमीन सांगलां आतां चॉकलेट्स, वेफर्स हे तुमी सगळे टीव्हीचेर पळयतात आनी तांकां एकदां संवय जाली काय तांकां तेंच आवडपाक लागता आनी तुमी तांकां तें आवडटा म्हणून मुद्दाम तें हाडटा. ना बाबूक तें आवडटा, ना बाबूक ही चॉकलेट आवडटा, बाबूक हें अमकें आवडटा, बायक हें अमकें आवडटा, बायक हेंच आवडटा, ना तें आयल्यार तें लायल्यार जेवता. अशें करून ह्यो नेगेटीव संवयो ज्यो आसात त्यो करूं नये आनी तांकां बऱ्यो संवय लावच्यो. हेल्थी डायट म्हणजे योग्य आहार, बॅलन्स डायट इज मोर इम्पॉर्टंट वर्ड. हो जो म्हणजे संतुलित आहार तांकां दिवचो आनी भुरग्याच्या सगळ्या एक्टिविटीचेर लक्ष दवरचें. ताका ओव्हरवेटूय जावपाक दिवचें न्हय. म्हणजे जशें आतां परत सांगलां की परत म्हणजे ते गुबगुबीत आसा म्हणजे बरें आसा अशें न्हय. तर हो नेगेटीव कन्सेप्ट, हो मनांतलो विचार काडून उडोवचो. भुरगें हेल्थी आसपाक जाय. तेचे सगळे शेड्यूल, वॅक्सिनेशन म्हणजे वाशिनां सगळें टायम टू टायम घेवप, ताका हेल्दी दवरप, ताका भायर फिरपाची संवय लावप, घरा कडलें अन्न दिवप. हे सगळे बारीक बारीक गजालींचेर जर तुमी लक्ष दवरलें जाल्यार भुरगीं बरीं जातलीं, राष्ट्र बरें जातलें आनी सगळ्याच भुरग्यांचो राष्ट्राचो फुडार बरो जातलो. तेन्ना आयची कार्यावळ सोंपयतना मॅडम यू हॅव स्पेड युअर प्रेशियस टायम. वी आर ग्रेटफूल टू यू. तुमकां सगळ्यांक काळजांतल्यान देव बरें करूं. बऱ्योचश्यो गजाली तुमकां समजल्यो आसतल्यो, नव्यो गजाली तुमकां कळ्ळ्यो आसतल्यो. ज्यो तुमकां कळ्ळ्या त्यो तुमी बाकीच्यांक सांगून सगळ्यांकूच सुशिक्षीत करचें आनी हें ज्ञान सगळ्यां मेरेन पावोवचें अशी इच्छा करून आयची कार्यावळ सोंपयतना तुमकां सगळ्यांक मना काळजांतल्यान देव बरें करूं. नमस्कार.